I am Dr. Chris Cormier, founder of the Nerve Health Institute, founder of Body Charters. Today, I want to talk with you about knee pain and knee problems that people get. So there can be a myriad of mild all the way to very, very severe problems when it comes to your knees. And they can limit you tremendously when it comes to just your normal day-to-day routines. I think most people don't realize how much we use our knees. And so I'll never forget, about probably 12 or more years ago, we had this lady come in. She was an avid tennis player, and just one day she developed knee pain. Basically went into her orthopedist. Orthopedist said, yes, you have a torn meniscus and you need surgery. So she thought, oh good, I'm just gonna have this routine surgery. I'm gonna feel better, and I'm gonna get back to playing tennis. Well, unfortunately for her, that did not happen. She went in for the routine surgery and basically came out of the surgery with an infection. And after they said they're going to go back in, try to remove the infection, that didn't work. We were able to get her in. We literally just started working on this lady, doing the technology we had at that time, and fixed her entirely. And her knee, I swear to goodness, went from this big down to like this big. And it took some work, but we got her completely better. And she has referred countless patients. She's still a patient nowadays, still playing tennis, doing all the stuff she wants to do. So let's say you tear your ACL ligament, your anterior cruciate ligament. It's in the front of your knee. It's a pretty big ligament. And I've actually been around the football field. I'll never forget, on multiple occasions, unfortunately, where I've heard them pop. If you've ever heard that sound, it's pretty crazy how you could pop, a ligament that's pretty big around like this. So in the surgery process, they'll go through surgery, and the likelihood that you're going to tear the ACL after the fact you have surgery is like 90% that you're going to tear it again. And what they're missing in this is something we call energy flow. And that's something we do here. So everybody's very familiar with blood flow. Heart is here. It's pumping blood to and from all your parts. Well, guess what? Your brain is here, and it's pumping energy to and from all your parts. That includes all the little tiny little muscles around your knee, the front, the back, the sides. It even provides energy to all the bones that are there around your knee. It even provides energy to the ligaments and to the tendons and to the connective tissue that's surrounding your knees. So I want you to visualize, in certain athletes right now, they'll run and make 1,000, 10,000 cuts, no problem, no contact, and they never have any knee issues. And all of a sudden, one day they go off of practice and just make a routine cut with no physical contact, and they tear an ACL. How is that happening? That is happening by a lack of energy flow from the brain to various connective tissues, muscles, tendons around your knee. And that makes the knee weak, weaker than you would realize. And basically you get a tear. And you've done that many, many times, never had a tear before. And then you're left with a tear. And then because you go in and have surgery and you don't fix the energy flow that started the problem in the first place, the likelihood you're going to get another tear is even greater. And so from our standpoint, we want to fix these issues before they even start. And we want to make sure that you're the person out there that's not going to just be the normal Joe Blow walking around, twist, turn a certain way and tear your ACL, or the athlete doing the same. We want to make sure that the energy flow from your brain to all the structures around your knee and your leg in general is all connected and powered at close to 100% to where your knee is doing what it's designed to do. The weaker the energy flow from the brain to all those structures, the more the knee wears down. So I have another lady who came in that before she started, she tore her ACL, and she pretty much opted for no surgery. She's very active and likes going on pretty aggressive hikes and staying very active in terms of physical fitness. And so those types of patients, what we do here is we get into the brain and restore energy back to all the connective tissue, muscles, tendons, bones, everything around the knee. We'll never heal that ACL again. It'll stay torn. but we want to make sure that all the energy supply to all the different structures on the front side of the knee, especially, and on the sides of the knee, everything's connected and powered like it should be, so that it's actually compensating properly for that torn ligament on the inside. So she's never had surgery and been on many, many different hiking events and everything else that she does, and never had any issue. So those are the sort of things that we're able to help with and help get to the root of the problem. That's the big thing in these types of conditions. You want to get to the root of the problem, and the root of the problem oftentimes lies in a lack of energy flow to particular parts. And that energy flow turns into a symptom. And if you don't fix that symptom, it'll turn into a tear or a break. And then it'll turn into all these other sequences of events. And we want to stop that as soon as we possibly can and get you back on the path for keeping your body functioning as high as 100% as possible everywhere, in addition to your knees. So if you have knee issues, I highly recommend that you come here to the Nerve Health Institute. We can help you resolve the root of these problems.